What's up, beautiful people? It's your girl, Crissy, and I'm back with another video. In today's video, we're going to be answering all the questions that you guys have been asking me about my Bela infusion. I do the Bela infusion because I got a kidney transplant. So if you guys know anyone that could benefit from these types of videos, please go ahead and share with them. And if you're new to my channel, what's up? Take a moment to hit subscribe to be notified when I post my next kidney videos. All right, guys, let's go ahead and get started. So when I first got my kidney transplant, I wasn't on the Bela infusion initially, but it was always been part of my treatment plan. Emory already told me out the gate that they were going to put me on the Bela infusion, but I needed to be on Prograf for 9 months. The only reason why I was on Prograf for about a year, I would say, is because the pandemic happened and it was just a lot of moving parts going on, and they had to figure out how they were going to get people back into the hospital safety to get treatments done. So they pushed me off and they kept me on the Prograf for some time. But I was dealing with a lot of side effects from the Prograf. I'm talking tremors, hair loss, the vertigo. I just wasn't feeling good at all. I was constantly sick. And so they were, having to check my numbers. For those of you that got a kidney transplant, you know what I mean. We do a lot of labs when we first get our transplant. So here comes month 9, and they're telling me about it. They're prepping me. They're getting me ready. So a couple months later, they said, all right, we're ready to introduce you to the Bela infusion. So for those of you that have been asking, the Bela infusion is an anti-rejection drug, right? I have to take Belatacept, you guys already know that, and I take prednisone 5 milligrams every single day. With the Bela infusion, I only go into the hospital setting or the infusion setting, depending on which one I have an appointment for, because there are options. I don't always have to run into the actual hospital, but I can get my infusion done at an infusion center. So I go in there for about 30 minutes every month. I only go once a month when I go and get my Bela infusion, which is the nice thing about the drug. And why I said yes, I'm so for it, because it's one less pill that we have to take. I know that I'm very blessed and I don't have to take a lot of medication compared to a lot of people. There are some of you guys that are taking a list of medications still because there's other issues going on. So for me, I lost my kidneys due to lupus, and that was the only factor, and the pregnancy was pretty hard on my body. So like I said, I'm only taking the prednisone, which is going to help with my lupus, keep everything quiet, which is what we want, and the Belatacept just as well. So between just taking those two every day, and all I had to do is go into an infusion, I was so for it because it was just less pills for me to take. I don't know about you guys, but I don't like taking medications. I don't like taking a lot of drugs. So sitting down in an infusion center once a month, I'm for it, right? Because I came from the world of where I had to do dialysis for 3.5 hours, 3 days a week. So they're telling me, come in, do an infusion for 30 minutes once a month. I was so for it. And it's different, right? Because when I do the infusions, they're actually administering this into my veins. And it's not like how dialysis were, where you have to get, both, the cycling of the blood. It's not that. They're just administering the drug just like they would. Just put the needle in, you sit there for 30 minutes, it drips from the bag, and that's about it. But so many people had a lot of questions in regards to the Bela infusion. And I think it was important that I make this video because every time I go and I do my Bela infusion, I do a day in a life and I bring you guys with me, because not every treatment is the same. Not every time you might feel the same, but also just the circumstance around you. For those of you that saw my last Bela infusion treatment, somebody wasn't well. There was ambulance, there was everything going on. But again, I don't know what that person's circumstance was. This is why I tell you guys, make sure you tell your loved ones that you love them, right? It's a side note for this video, because you never know. Just because you're feeling good doesn't mean that anything can't happen to you, right? So just make sure that you're telling your loved ones that you care about them and you appreciate all the work that they're doing to help support you throughout this process, because it's hard on them just as well too. Caregivers that's a great video to do. You know what? I'm going to jot that down, just talking about caregivers, because a lot of you guys watch my channel, and I'm going to bring my caregiver on to the channel and talk to you guys a little bit. So if you guys have questions, make sure you comment below and let me know, and I will go ahead and ask them. But back to what we're talking about, the Bella infusion. So there was a lot of questions in regards to, why do I take the Bella? How is it administered? There's so much that I have them on my phone. So for those of you that do not know, from time to time in the YouTube community, there is a community tab, and I go in there and I ask you guys questions, and this is where I get a lot of the feedback from, and I go ahead and I make the YouTube videos based on what you guys are asking in the comments of my videos and what you might ask me in the community tab. So make sure you're checking out the community tab as well, just to stay up to date of any changes, anything coming. That's where it's all going to be. So let's go ahead and talk about this. So the Bella infusion is an FDA approved therapy. Okay, this was done in, I want to say, 2011, and it's had great results. And because of the safety and efficiency of it, it was approved through the FDA. So I just want to let you guys know that for those of you, it wasn't a question that came up, but I like to make sure that I give you guys all the information, as much as possible. Go ahead and review all of that. What I really liked about the Bella infusion versus me taking Prograf, minus that I don't have all of those side effects, is that people that are on the Bella infusion, according to the researches and studies, and you guys, do your research. Don't just take my word. Do your research. Read publications. Take time to educate yourself, because like I tell you guys, you got to be an advocate for your own health. But I love the fact that a lot of those patients didn't deal with hypertension, diabetes that come along with some of these drugs. Some people that I know that are on Prograf deal with high blood pressure. Or ask yourself, are you dealing with diabetes over time? But with the Bella infusion, it lessens that, they say. And so I was really intrigued by that when I was reading some of the publications in regards to that particular drug, because I don't want to take one drug and it causes something else. We all know that these drugs, they're drugs, right? And they might help with one thing, but they might cause another issue. And we already know that. The fact that I'm alive, that's just the first step. That's just the hump that I'm willing to take. I'm alive to be here, to watch my kids, to enjoy life, to come on here, make these videos for you, and just to do my calling. But there are things that might happen in the future. This is why they tell us to make sure you're going and you're getting a body scan done. You're seeing your dermatologist for skin cancer, anything, because we just never know what can happen. But reading those publications and hearing some of, like the hypertension and the diabetes are not as common in people that are taking the Bella infusion, that was a good sign for me. But let's get back to these questions that you guys have. So people want to know, why are you taking the Bella infusion? I'm taking it because it's part of my treatment plan, right? It's part of me staying alive. It's a drug that's helping me stay alive. It's an anti-rejection medication. It goes along with my CellCep and my prednisone just as well. And that's what my team at Emory, and Emory's a great hospital in regards to innovations, things of that nature. And this is something that they've done research on as well. And they're telling me that that this particular medication, this therapy that I'm doing, should help me keep my kidneys longer. And that's what it's all about, right? Not just to get a kidney and lose it. I'm trying my best to keep this kidney as long as possible, because my brother gave me this organ and I'm completely grateful. So not only am I doing what Emory's telling me, but I'm doing my part by eating right, by working out, and doing the necessary things that's going to keep me alive. And you guys should just as well too, because someone giving you an organ is a big deal. So make sure that you're doing, not just taking your medications in a timely manner, but make sure that you're working out and you're staying stress-free, and you're just, having a attitude of gratitude because of someone, you're alive today. So the reason why is because it's part of my medication plan. The next question is the Bella infusion a lifetime thing for you? Yes, it is a lifetime thing. It's just like taking CellCep. It's just like taking any other drugs that's part of your treatment plan. Without this, you can go into a rejection and lose your kidney. So it's just like without you taking Prograf or whatever medication you're taking. It can help, it will, make you lose your kidney. And I don't want to lose my kidney. So yes, it is a lifetime thing that I have to go through. Some people are deterred from taking Bella infusion because of the cost of the Bella infusion. Now, again, it's finding insurance companies that are willing to pay for that. You're going to have to go down the list, especially when it comes to renewal of insurance, which we are coming up on. So for those of you that want to switch your insurance, make sure that the first thing I'm going to tell you before you switch off of your carrier is call the insurance company themselves. Speak to the claims department. Ask them, do you guys cover Belatacept? Do you cover the prednisone? And do you cover the Belatacept infusion? Right? These are things that you need to be asking before you switch. Even if you're moving out of this state, right? Because you have a treatment plan. And you want to make sure that when you're transferring hospitals, that they are aligned. They know about the Bella infusion. And because sometimes you might transfer to a whole different city. Because there was a time, yes, there was a time I thought about moving. And when I thought about moving, my doctor said, make sure that they do the Bella infusion, because you would have to go back on Prograf. And Prograf is not my testimony. That's not what I want for myself, because I know how I felt when I was on that particular drug. So I made sure that I called, and they were like, no, we don't do that here. And I'm like, oh, never mind. So I told my husband, that wasn't a place that I wanted to go. And obviously there are a lot of other hospitals, but I have to find one that is a kidney, that focused on kidney transplant. That's what I was told. But I'm not planning on moving anytime soon, so I don't have to worry about that. And again, if I go on vacations and do things, I kind of plan my travel around my infusion. I know my infusion is, when you do your infusion, it's around the time that you got your kidney transplant. So because my transplant is in the beginning of the month, I usually do my infusions at the beginning of the month. Now, they do give you a grace period, but you don't have a long grace period. So even if you're a day or 2 or 3 off, it's okay before or after, just depending on what you might have going on in your life. They know that people have things going on, and you might be delayed on that, but you can't go weeks at a time. You can't, you have to take it as planned, just like how you take your medications at night. And in the morning, make sure you take your Bella infusion on a timely manner. So yes, it is a lifetime thing that I have to do, and I'm okay with that. So make sure that you're okay, whatever you're doing, that you're okay with it. So the next question is the Bella for rejection? I get this on almost every reel that I put out. When I'm showing me going into the infusion center, getting my infusion, telling people that this is what I have to do to stay alive, they think automatically, oh my gosh, what's wrong? Are you going into a rejection? No, I'm not going into rejection, and you guys will be first to know if that ever does happen to me, and we're going to pray in the name of Jesus that does not happen. But no, I don't take the Bella infusion because I'm going through a rejection. I'm taking it because it's part of my treatment plan. It's part of my medication that I take on a monthly basis, and it's only once a month that I'm doing this. So no, I'm not taking it for rejection. Don't think I'm going through a rejection when you see these types of videos, especially when I say an infusion day, my treatment day. That's what I'm talking about. Next question, what side effects does the Bella infusion have? Now, every drug is going to have a side effect at some point, possibly, right? I'm never going to say, no, there's absolutely no side effects. But for me, just being transparent, I haven't seen any major side effects that stands out to me that I know about. So for me, yes, sometimes I might get a little tired and I'll go home and just relax. I mean, it's a long day. I'm going through the works. I got to get to the treatment and I got to do it. And so yes, there are times where I am tired, but I haven't seen, like, my hair is growing back. Look, this is my natural hair. So I wanted to come on without any braids or anything, because I wanted to show you guys that there was a time where I was completely bald and my hair is growing back. And this is with me cutting my hair over time. So my hair is growing back. It's not dropping out. I'm not dealing with any side effects. My skin looks good. I make sure I'm keeping up with all my doctor's appointments. So no, I don't have any side effects, I would say, but that doesn't mean that other people aren't having side effects. This is why it's important for you to align yourselves with, kidney groups and other organizations and see what other people are doing and feeling outside of me. Now, I come on and I'm just telling you guys my personal testimony, what I'm experiencing, right? And so I personally have not had any side effects. I'm not saying that there won't be, but for me, no, I haven't. So, and I'm so thankful because, again, I know there's a lot of people that deal with so many side effects from, all the drugs that they have to take on a daily basis. So let's see what other questions you guys have here. How long does the Belatacept infusion take? So it takes about 30 minutes. Now, I'm not going to tell you just, do this on your lunch break. It's 30 minutes only. No, because you actually have to get there. You have to check in. They have to weigh you. They have to make sure, they answer some questions. They always ask you questions before you take the infusion. And then they have to make this infusion, right? So it's not something that's just pre-done and it's sitting there, right? No, it is a drug that has to be administered to you depending on your weight. So that's something that I did want to talk to you guys about. Now, when you do your infusion, it is not going to change. The dosage is not going to change unless you gain over 10% of your weight when you got started. So for me, my dosage has changed one time. And when I did see because I like to look at the bag, I look to see what's the milligrams, what's going on when they're doing my infusions. Again, I'm an advocate for my own health. I ask a lot of questions. So yes, that is going to change. Your infusion dosage will change if you gain weight. So for those of you that know and you've been watching me since the first video, when I got out the hospital, I was either 103 or 106 pounds when I got my transplant. I mean, skinny mini, collar. Like you guys see how I look now. I feel vibrant. I'm good. If you go back to some of my old videos, I didn't look how I look today because I was small and I just got the transplant. So I gained a lot of weight. Right now I'm about 150, okay? We were whispering that, but I'm about 150, 154. I fluctuate depending on what's going on in my life and how much I'm eating. But I'm about that on average. Do I want to come down a little bit? Maybe a smudge. But I'm happy and I'm confident in where I'm at right now. So because my weight gain happened, and I told you guys, the medications that we're taking will pile on the weight. This is why it's so important for you to work out and take care of yourself so you don't develop any other issues. So my dosage did go up because of my weight gain. But what was the question again? How long does it take? It takes 30 minutes for the infusion once it gets started. But they have to make the drug depending on your size and whatnot. And they have to know that you actually have your IV in and you're ready to go. Nobody wants to make a drug that's very expensive to make and then you're having issues with your veins. So they're going to wait and make sure that, you're all set, you're all connected, and then they're going to go ahead and make the particular drug on your behalf. And then once they make the drug, they bring it in, they verify all the information, make sure it's you, because we don't need any issues. We don't need any mix up with the drugs. And so at that particular time, the nurse will come in, she'll hang it on the bag, and she'll connect me, and she'll say, all right, you got 30 minutes. So once you do, and plus they have to do like blood pressure to see where your blood pressure was before and after you do the Bella infusion. They take your blood, not your blood, but they take your blood pressure just to see what did the drug do to you. Did your pressure jump up? Did it spike down? Are you normal? Are you okay? Can you leave here and drive? So yes, that is, it's not long, but there are other factors going into that. And it depends, are you having a busy day at your clinic? There's a lot of different factors, but the actual time for the drug is 30 minutes. Let's see if I have any other questions. No, that was pretty much it. It wasn't a lot of questions. in the community tab. And maybe because I'm rushing, because I wanted to do this video, so I was so excited when you guys started asking me questions in my vlog in the day of the life when I did the infusion. You guys were asking a lot of questions there. So that sparked me to go ahead and make this video, because if somebody's asking, that means there's somebody else thinking and may not have actually had the courage to come out and say, hey, Crissy, this is what I want to know about the particular drug. And I hope that I answered all your questions for you guys today. And if there's more questions, please continue to ask, comment below, and I will answer all of that for you. Do not hesitate. I am the nicest person. This is my mission, right? And I feel like this is what God wants me to do, and it's to come out here and help the chronic illness community as much as possible. So this is why I come on and I make these videos weekly. And you guys already know how we get down on Instagram and the stories. And I like to make this enjoyable because so many people are struggling out there, right? So many people are battling. And if I can bring a little bit of joy and a smile to your face, that's what matters. And that's what I want to do. I just want to be that light for you. I want to be there to help the hopeless. For those that are struggling, that just need a little bit of hope, I want to tell you to continue to hold on. I know there are going to be days where you're going to be down, and but there are going to be good days as well. And let's appreciate those good days when they do come. So for those of you that are new to my channel, welcome. Introduce yourself. Let us know where you're tuning in from. I love you guys and I appreciate all your love and support. If you have any questions, comment below. Otherwise, I'll see you guys on my next video. See you guys next time.